Welcome to the latest webinar from Cosmetic Laser Dermatology. You are tuning into a webinar where Dr. Fabi is going to talk about how to enhance your features, not change them. So she's going to review which procedures prioritize a long-term approach to your face and body, and that will focus on your skin health and balance. And there is a really great offer for those of you that attend today. So every single person here, very generous of Dr. Fabi. She's offering 10% any of the XOMD products for everyone that came here, which is amazing. Plus, one lucky participant will win a complete XOMD skincare package. So we are very excited. So before I hand it off to Dr. Fabi, I imagine you all know her because most people do, but in case you don't, Dr. Fabi is a board certified dermatologist. She's been with the practice for decades now, it feels like. And she is really renowned all over the world for all sorts of cosmetic laser dermatology. Today, she's going to be talking about injectables, lasers, but she also does all sorts of cosmetic dermatology treatments from body sculpting to veins and everything, and hair loss and everything in between. And vice versa, we do have amazing other board certified dermatologists at our practice, and they also offer many of the procedures you're going to hear about today. So, without further ado, Dr. Fabi, the floor is yours.
Wonderful. All right. Hi, everyone. For those who don't know me, I've been at the practice now going on my 16th year. And I also am involved heavily in clinical research. So I get and have the fortunate privilege of using many of these products before they come to market, years before they come to market, to be able to have an understanding of their applications and how to best utilize them for optimal results. In my investigations, I've been fortunate enough to also discover unmet needs. And so that's what led me to invent with my partner, Dr. Stephen Dion, a product line called XOMD that minimizes the inflammation at the level of the skin because ultimately we know that aging is an inflammatory process. So we'll be doing webinars later this year covering drugs today that are approved for decreasing, overall sugar in the blood that now also decrease inflammation. So this is longevity is a space that I'm very much interested in, but hormones play a significant role in that. And so that's another kind of focus of my research. And so I'll be covering a little bit about that invention throughout today's program. But my passion really lies in helping people look beautiful throughout the course of their life. And most importantly, making them feel great throughout the course of their life. And as people are living longer, you definitely want your skin to match that health span that we're all so much trying to optimize. And so we call it skin span at the office, a term coined by my associate, Monica Bowen. And so today we're going to be covering a little bit about that. So when people look unnatural from some of these aesthetic procedures, I kind of like to simplify concepts. And so I think of it like a chocolate chip cookie, right? A chocolate chip cookie is more than just chocolate chips. It's more than just flour. It needs a little bit of everything to be an optimal chocolate chip cookie because you can't just rely on brown and white sugars for the cookie or it's going to be taste too sweet and it's not going to be as enjoyable. And you can't just rely on flour for your cookie because if you put too much flour, it also won't look or also won't taste so good. And the same goes with the face. There's multiple tissues that are aging as we age. It starts with our skin losing its antioxidant reserve in as early as our 20s. So when people are like, how young is too young? Well, you can start doing things proactively for your skin in your 20s, and you start losing bone in your 20s at the age of 25. That bone loss becomes significant in your 30s, specifically 35. So, when can you start thinking about doing things for your volume loss? Perhaps around that age. And then muscle is draped on that bone, and you've been frowning, laughing, smiling all your life. But all of a sudden, you're creating lines after you frown. You create lines, especially at the end of the day, you notice that those lines are remaining in your forehead. And it's because you no longer have the bone to support that muscle's resting tone. Muscle likes to be able to find a nice taut surface to relax on. And since you don't have it anymore, you create the lines. So there's a place for treating muscle as well with neuromodulators such as Botox or Dysport or Daxify. And then you're losing fat. This fat loss, we generally see that's a little bit more ethnic um, derived, in that certain ethnicities lose that superficial fat, like the Caucasian group loses that fat usually a little bit more rapidly than, let's say, an Asian or Hispanic patient. But if people are on GLPs, we're seeing that this is accelerated. And so that's going to be the topic of my talk in March. But for the most part, every single one of these layers has to be addressed for a natural looking outcome. And doing too much of any of those things, just like a chocolate chip cookie, can make a chocolate chip cookie not taste so good, can make the face not look so good. And I think that that sometimes leads to some of the unnatural looking results we see. But back to that face, and for some reason it just keeps bouncing on me. If we look at that face, that's not filler. That's an overuse of surgery. And so there's this trend that we're seeing about preserving the face and not doing fillers or injectables to do a facelift, but sometimes it's bad facelifts that cause the most extreme unnatural results that are not reversible. So that's something to be mindful of. And the ideal is someone like Jennifer Aniston, right? Where 25 years later, she looks not so different than when she was perhaps in her 30s. And so the goal is that you know she's done something to look the same, but to not be able to spot it. So it's to not be able to see that particular ingredient. And so to do that, the perfect recipe relies on a little bit of addressing the bone, a little bit of addressing the fat, a little bit of addressing the muscle, and a little bit of addressing the skin, and not going overboard with any one thing, and also having an aesthetic provider that recognizes when one of these issues is causing the majority of the problem that is bothering you. So let's talk about the skin. My bias here and my disclosure is I'm a dermatologist, so naturally I'm always going to have the bias that, addressing the skin is a great way to start. But the reality is that you've never seen someone that just does skin stuff that looks unnatural. So this is a safe place to start. And it's an area that when studies have been done to rate what makes someone look the oldest, it's not their nasolabial folds and it's not their jowl. It's their skin. It's the length between their nose to their lip, and it's their hair, gray hair and specifically. So if you really want to look younger, doing things for your skin, doing something for the distance between your nose to your lip, and dyeing your hair are probably going to be the fastest ways to do something to make you look younger. So investing in skin is important. And so when we talk about the skin, this is something I published on. It's there's multiple things that give one's age away when we look at their skin. And it's not just red or brown, it's also texture, which starts to get worse with the skin no longer turning over as quickly as it did in its 20s. Now it turns over 35 days in its 30s, 42 days in its 40s, 60 days when one is 50 and over. And so now it's not as smooth as that baby smooth skin that one had when they were younger. And this adds a dullness to the face. And so these things all contribute to one's skin quality. And all of these metrics in an ideal treatment plan should be addressed. So when people come to me and they went to the mall and they got one laser procedure, and they're like, and it's probably because not as many metrics to their skin quality were addressed with one laser. And that's why we're privileged at cosmetic laser dermatology to have many different devices that we like to couple in order to address as many of these skin metrics in one treatment as possible. Lines and wrinkles matter. In fact, more than any of these metrics, they contribute the most to perception of age. And then, of course, the crepiness under the eye, the crepiness of the skin, and then the heavy laxity that ensues along the jowl and the neck. So these are all things that one looks at when evaluating skin quality, because ultimately we want smooth skin. So even in someone in their 20s, acne does not contribute to optimal skin quality. So we can treat that with a series of lasers and lights to improve that. acne and acne scarring. So here you can see all the modalities that needed to be done, photodynamic therapy. Then we needed to combine it with the pulse dye laser and a Fraxel. And you can see how we're able to improve that skin quality. Same in this beautiful woman. She looks very natural, right? So just treating her skin quality makes her look more attractive, doesn't change her intrinsic feature, and addresses her issue. And so you can see the different combinations. Every single person gets a more personalized combination because everyone has a different issue and a different skin type. In this half Japanese patient, I used an IPL to address her freckles. And so you can see that when you address the pigment, her quality of skin looks better. But in melasma, you may not want to do an IPL. You may need to do a different laser that doesn't go as deep. And so with her, I did a Fraxel dual. And you can see that by just addressing her melasma, she looks better. And so this is the point of this section, is to just highlight the one ingredient of the cookie that we talked about earlier. If you're just focusing on the laser element, that makes a difference in the longevity of one's aesthetic journey. But we're going to talk about mixing all of these ingredients later at the end. In this beauty, she's 49 years old. You can see that when combining using our proprietary Take 10 laser combination, she looks phenomenal by just addressing her skin quality and doing a little bit of Botox along her jawline so that the corners of her mouth don't go down as much. So she looks healthier, she looks more vibrant because I've not only addressed the pigment, but I've restored dewiness and glow to the quality of her skin. In this patient who had acne and acne scarring, she first presented for me to address her acne scarring, but it wouldn't be appropriate if I did acne scarring treatments without addressing one's acne first. So I did photodynamic therapy first, and there I shrunk the oil glands with the topical that gets absorbed preferentially by the oil glands and then gets activated by a series of lasers and lights. And in our practice, we do a series of 2 lasers and 2 light sources. And then that usually gives 80% of patients 80% improvement in 1 month. And then I coupled it by following it a month later with a pulse dye laser combined with a Fraxel. So you can see that she looks like herself, but she looks like a more attractive self because her quality of skin is better. So if one has to enter the aesthetic journey and is scared of looking unnatural, addressing and prioritizing your skin is never a bad idea. Now, it's not just for the young. This beauty's in her later 30s. She hadn't done anything, but by combining with a series of lasers in one session, which we call the Take 5, you can see that we've restored the glow and we've removed that texture that she had on her skin. And she looks healthier and younger. And it's not just someone in their 40s, it's someone in their 60s. You can see that in her, the 62-year-old, by just addressing her skin quality, she looks younger. So there's no doubt that investing in your skin quality with a series of different lasers and lights in a single session can make a difference. Now, we also have the Take 10 because sometimes people have more deep lines associated with their skin. And like she had these kind of deeper radial cheek lines, which we call them the cheek lines. She also had a heavier lid. You can see the skin touching her lashes in the before. And here she is after a Take 10 treatment, looking a lot younger, and the quality of the skin around her mouth is improved and her eyes are more open. So sometimes if one hasn't done as much leading up to when they start their aesthetic journey, they may have to do something as aggressive as a Take 10, but it definitely recalibrates one's baseline so that then some of the other procedures that we do have a much greater impact. Now, it's not just lines and wrinkles. Sometimes the redness and the texture that we have in our skin is associated with precancerous spots. And so you can see in this woman's cheeks, those are precancerous spots. So, photodynamic therapy can be utilized to not just address something that's medical, but also address the red and the brown. So, this is where going to see a board certified dermatologist is important because not all red and brown on the skin is just age related. It can be even precancerous. So you need someone who has that expertise to be able to diagnose first before coming up with a treatment plan. This beauty also had the Take 10. You can see it made a beautiful difference in addressing the crepiness under her eye, which you can see really contributed to a visual cue of age. And it almost made her look squinty, but it tightened all of that tissue up. And she looks like she's almost had a surgical procedure, but it really has taken 10 years off her eyes. This other beauty with Take 10, she is 69 years old, and you can see how much more improvement in a single laser treatment session we've been able to get. So that single laser treatment session again is like a cookie. It's like the perfect combination and recipe of a combination of lasers all done in one single session in order to get an optimal result. And in being able to do that with 5 different lasers in her case, one to treat the blue veins that were bulging around her eyes, the 2 lasers to treat the skin laxity around her eyes and mouth, and then the other laser to address her pigment, and then finally a fractionated CO2 to address all the radial cheek lines. She looks 10 years younger after just a month. Now, not all skin quality issue is lines, wrinkles, red, brown, or texture. Sometimes it's laxity. And in this 48-year-old woman, you can kind of see how she's got redundancy in jowling and excess skin underneath her mandible or jawline. Now, here, some people might want to go do a facelift, but if you're okay without perfection or you're not quite ready for a scar in front of your ear, you can easily do all therapy. And here she is 2 weeks later, 2 months later, I'm sorry. And it does pick up that tissue nicely. I generally tell my patients between 20 to 30% contraction. And so it looks better with no scars. Now, the question I always get, and I know this is more geared towards patients, but it is important for those that are my patients. You know that I'm a nerd at heart, and so I always like to kind of share the literature with you, is that if you do laser treatments over time, know you're not thinning your skin and know you're not making it more susceptible to something in the future. In fact, this is a great study that shows that the use of 3 broadband light treatments or IPLs, actually when they biopsy the skin, showed gene expression of skin that was actually of a 20-year-old. So when you do these procedures, you're actually biologically changing the age of your skin. And that's going to be hopefully another session that I do later this year, which is biohacking the skin. But you are in essence biohacking the skin. And this was an interesting study because then sometimes people are like, well, I have more melanated skin, I'm Hispanic, I'm Asian. Well, this trial was out of China, and they actually looked at 2,500 patients using the IPL that we have in our practice. And at minimum, in a 12-year period, they had 3 IPLs, but ideally they had one a year. And 12 years later, they showed to have skin that almost looked younger than when they commenced, 8 years younger. So, doing these treatments can biologically change the age of your skin. And this applies not just to Caucasian skin, but in my practice, I treat 30% Hispanic skin, 10% Asian skin, and 10% South Asian and Middle Eastern skin. So, I treat all skin types, and I can tell you that it applies. It's just using the right lasers for the skin type. So, in this beautiful patient of mine, what does it look like after years of doing it? She's half Japanese, half Peruvian. And doing the right laser combination, she just wanted to do lasers and a little bit of Botox. 7 years later, she looks younger without any filler. So it is absolutely possible when you just address your skin and even do a little bit of toxin along the way. I did toxin and laser to her face and her neck, and here she is 7 years after starting her journey with me. And now there's even literature to support that doing lasers might be epigenetically modifying your skin to revert it back to a more youthful state. So, again, I started with my disclosure is that I'm a dermatologist and my bias is that I prefer the skin. And there's definitely more and more to show that we're actually changing and reverting the age of the skin with the lasers that we do. Now, it's not just lasers, of course. Um, if we're really going to come up with a comprehensive plan so that one can look optimal 10, 15 years later. And many of you who follow me on Instagram will see that I like to always post on folks, many years after starting their aesthetic journey. And that's something that I encourage you to always look at when deciding who you want to go to for your aesthetic procedures. You want to see that this person has an eye to not do too much and that the interventions aren't too much so that these people look radically different years later. That's not the goal, right? And so it's being strategic about where you place product. And so not filler is not bad. It's just bad when it's placed in the wrong place. And so we know that bone is going as we age. It becomes significantly less at 35. And then there's another exponential time when someone loses it. And that's usually when one goes into menopause, whether it's surgically, medically, or just biologically induced. And so the orbit, the floor of the eye is widening. That causes the nasolabial folds that we're seeing. It also goes in, so that causes the nasolabial folds that we see. And so the orbit widening causes a tear trough. The orbit going in, the maxilla going in causes a nasolabial fold. And then menopause specifically, but after the age of 40, the mandible goes in and up. And that's what contributes to some of the jowling. So sometimes people want to address their jowls, but they don't want to do filler. And that's okay, but it's not going to give you an optimal result because a part of it is the bone, that jowl bone that's resorbing. Now, if you couple this with a weak jawbone to begin with, which we usually see in our 20s, then you already had less of a reservoir to begin with, and the result's not optimal if you don't treat that. For instance, this 26-year-old, you can already see that she looks like she's having some jowling, and that's because she had a weak mandible to begin with. So this is just doing filler along the jawline. This is 8 months after her injection. You'd never see her on the street and be like, oh God, that filler looks horrible, or wow, look at that jawbone. No, she looks very natural. It can be done well, and it's optimized her jawline. And it's not just in a 26-year-old, it can also be in a 40-something-year-old. She had a weaker jaw to begin with. She had a weaker maxilla to begin with, and the maxilla is the mid face bone. So by creating some structure, you can see that she looks better, and you would never catch her at the mall and think that she's done anything. This is one of my medical assistants. Some of you may know her. She also had a weak maxilla and a weak jawbone to begin with. And by putting some sculpture into her midface and then some filler into her jawline, here she is 7 years later. So the additive effect of doing these procedures can actually make someone look prettier over time, not distorted. This was a model, a live model that I had to inject in the Middle East. And you can see that she came in complaining of a double chin, but her double chin is caused by a lack of bony structure. So it's important for whoever assesses you to have an understanding of why you have the issue you present with, because it's not that the procedures don't work, but if not applied properly, then you may not get the result that you want. And so in her, if I would have done a skin tightening procedure to lift her tissue, she wouldn't have seen much, not because the procedure doesn't work, but because she does need filler if she really wants optimal lifting of that tissue. And it's not just women, it's even male models like this patient. You're like, what does he need? But he doesn't look done. He actually looks more attractive by doing a little bit of radiesse along the lateral aspects of his cheek and along his chin and jawline. So, in fact, there is a great study out of Japan that shows that putting filler on the bone was actually found to be replaced by a little bit of ossification and calcification because you have cells that can be stimulated that reside on the bone that respond to this material. So, again, over time, these products are actually doing something biological to your tissue that could be of benefit. Now, muscle. Muscle, as I mentioned, doesn't really get bigger or thicker with age. The only reason that you start to see the lines and the wrinkles that you're starting to see in your 20s is because you start to lose bone in your 20s. And the only reason that it becomes worse in your 30s is because the bone loss becomes worse in your 30s. And so this contributes to just about any place that you have muscle on your face. The glabella, which causes the 11s, the forehead lines, the crow's feet lines, the bunny lines, the gummy smile for the muscle that pulls the upper lip, the orange peel from the muscle that sits on the tip of your mandible, the masseters that contribute to the width of the face, and then the platysma, which is a muscle that the largest muscle out of all of the muscles that I talked about that drapes from the lower face all the way down to the clavicle. And it's the greatest depressor of your entire face. So you can imagine that as your mandible resorbs, this muscle doesn't have the structure to sit on anymore. And so its pull is greater. And so that contributes to the corners of the mouth being pulled down and giving someone the illusion of looking disgruntled. It's also the reason why someone might notice some jowling or an irregularity or lack of tautness along their jawline. So, all these muscles, it's more than just lines or wrinkles. It's having an understanding that if you can relax them, you can perhaps actually bring the brow up a little bit, or you can open the eye aperture so that one doesn't look as squinty when they're smiling. And that is a visual cue of age. So that maybe you don't need more filler in your lip, but what you need is to relax your masseters so that the frame looks smaller and you look more feminine. So it's understanding how these muscles interplay with the way that one looks. That's where the art resides. And so I'm going to give you some examples. This is a beauty that came in. You're like, what does she need? Yeah, she has a little bit of a weaker jaw, but in fact, by just doing a little bit of Botox to her masseter and her neck, she looks prettier. And then by doing a little bit around her eyes to open up her eyes and to lift her brow, she just looks a little prettier and you don't know why. So I actually look at the neuromodulators as a way to sculpt the face just as much as I look at the fillers as a way to sculpt the face. All of these things in the right hands are artistic ways to sculpt the face. This is another beautiful patient of mine. She came in because she felt like her lower face was heavy, but not all lower facial heaviness is secondary to fat. It can be secondary to muscle. And so if you slim that muscle down, you can actually make the face look prettier. And so in her, uh, it's not letting me show her all her angles, but you can see that she looks more lifted after doing a little bit of neuromodulators to her lower face. Same with this beauty. By doing a little bit of neuromodulator to her masseter, she looks a little bit more feminine. With this beauty, by putting a little bit around the tail of her brow and around her eyes, you can see that her eyes are actually more open and she looks younger. So those lines do participate in making us look not just older, but also brow position and the size of the eye make us look a little older. In this 48-year-old, you can see that she came in complaining of a little bit of jowling. And by treating her neck and her masseter, we've lifted her face up a little bit and she doesn't look as masculine. Again, with this one, by treating all the areas denoted by the green bars, you can see that, again, she looks more rested. You don't see the lines as much, but you don't see all the lines. So sometimes it's a lot of patients are like, no, I don't want to do so much Botox. But it's not about doing so much Botox. It's just about actually doing a little bit everywhere that gives you a better result than just doing too much in one area. And so another, misconception is, oh gosh, if I do Botox, I'm going to look unnatural. Um, that's not necessarily true. This was an interesting study that was done by one of my friends out of Brazil and the other one, my mentor, out of Canada. And they looked at patients on average over a period of 9 years that had been doing Botox. And what they found was after 9 years, when compared to their same age counterparts, they looked on average 7 years younger. So doing this stuff does make you look younger over time, whether it's the lasers, the fillers, and now here, even the Botox. Okay, one of the last ingredients of the cookie or last ingredients of the face that we have to address is the fat. So here with age, fat likes to shift a little bit genetically, and some ethnicities tend to have a little bit more fullness underneath the chin, specifically those of Asian descent and Hispanic descent. And we also see that with age, the jowl fat preferentially gets fuller as other areas start to flatten out. Now, as I mentioned, deep fat doesn't necessarily go away with age until one's 50s, but based on ethnicity, superficial fat might go away sooner and faster in Caucasians over African Americans, Hispanics, and Asians. So there are more ethnic variations when it comes to fat. This is an example of a Latina in her 20s. You can see that fullness underneath her chin. By just reducing her fat, she looks better. She looks more attractive. She looks prettier, right? You would not put filler in this face. Doing filler, because it's the easier thing to do, would participate in making her look unnatural. So it's choosing the right, in this case, ingredient to be able to give her the best results. Now, this woman, she's in her 50s. She doesn't just have fat, she also has some skin. So, an injectable Kybella may not do enough. She did ThermiSculpt because combining both can not only reduce the fat, but also tighten her skin. So, it's also trusting that your doctor is choosing the right treatment for you. I also did IPL for her to address her redness. And here she is 5 months later, she looks better and she doesn't have all this redundant tissue along her lower face, sparing her from a facelift that she's not ready to necessarily take at this time in her life. This is another beauty. She is 38 in the before, she's 45 in the after, with a combination of, again, ThermiSculpt and a little bit of IPL Clear and Brilliant for her face. She looks significantly better. And she didn't have to do a facelift nor get a scar in front of her ear to be able to accomplish this result. So this is a 5-day downtime and that you just need a little bit of tape. But again, great results. This beauty, she's 38. And again, by just reducing that fat, no need for filler. If you would have done filler, you wouldn't have been able to pick up all this fat. So sometimes I see people using the wrong thing in a way to skirt downtime. And in doing so, you end up with an unnatural looking result. So sometimes doing the right thing, even if it means downtime, is better than doing the wrong thing because it gets you a faster result. And she looks like herself. So I think, again, this just shows that natural looking outcomes are a result of a combination of using the right procedure at the right time, not because of downtime, but you doing the right procedure at the right time for the right issue so that you can optimize and benefit the most from it. Now, this beauty in her 40s, she had some of this was deeper fat. So we elected to do all therapy first. And in doing all therapy, it reduced a good amount. It didn't reduce all of it. So as long as someone has realistic expectations, because they don't want the downtime of ThermiSculpt, she looks natural, she looks like herself, and it looks better. So sometimes realistic expectations are necessary, I think, throughout the aesthetic journey. Once we start chasing perfection, the evil of good is perfection. And I think that that's another reason why sometimes people slip into a slope. So having the right doctor that's going to guide you and say no also helps along the way so that one can get natural looking outcomes for the length of their journey. So again, going back to our cookie analogy, right? We've talked about kind of all of the ingredients, whether it's skin, like the melted butter, whether it's flour being our filler, whether it's the eggs being what is going to reduce our fat, or whether it's the brown and white sugars, which are our neuromodulators. You need a little bit, a sprinkle of all of it, maybe a little bit more of some than the other, depending on what you start off with, in order to get the ideal cookie or the ideal face over time. So now when you put these things together, like the ideal cookie, it's not just a little bit of this, a little bit of that. It's also the quality of the material that you put into the person, right? The quality of the material that makes up the cookie, the quality of the flour, the quality of the sugar. Those things matter. And then when you put them in, right? It's like the perfect chef knows when to add the sugar or when to stop it from boiling. Those little things matter too. And so this is a patient of mine. She's one of my longest standing patients. She's been with me now for 15 years. And so we're going to look at her because, I want you to look at these before and after photos through the trajectory of some of these journeys and see how they still look like themselves. She's had dysport in her upper and lower face and neck. She's had Sculptra every about 8 months along her cheeks. She's had a little bit of Vobella in her lips. She's had a little bit of Define along what I call the labiomandibular sulcus. She's had what we call photofractional light every 6 months. And here she is 9 years later. And she looks like herself. Her quality of skin's even better. She's a little bit more lifted. She doesn't have as many lines here, but most importantly, she just looks like she hasn't aged. So the goal here is to celebrate subtle. It's to not try to go for a radical before and after photo every single time. I think that's what leads to natural looking results. Many of my patients don't even want to look at their photos. They just trust me. But this is the goal. The goal is that if you take a photo of you 5 years or 10 years later, you kind of look like you haven't aged, not that you look radically different. So that's somebody who started in her 30s, and in the after, she's in her 40s. Let's start with this lady. She was 48 when she started with me. And she's done a lot of Dysport in the upper, I'm sorry, Xeomin in the upper lower face. She's done a little bit of Restylane Define, Bellatero Balance for her lips, Sculptra, and Voluma. And here she is 7 years later. So she looks, even going through menopause, she looks younger in the after. She looks a little bit more balanced because many of these procedures can actually, when done properly, can help with the asymmetries that you can see in her before. Her brow was a little lower in the before, her right eye was a little smaller in the before. Things were now she actually looks more harmonious in the after. So these procedures can actually be used to restore harmony and balance to the face, not just try to make it look younger. All right, now we're talking to someone in her 60s. And so with her, I've gone again a little bit of Dysport, upper lower face, some Restylane Lift into her posterior temples. We've done some Define around the nasolabial fold, specifically the piriform, some Sculptra, some Vobella, and of course, IPL Clear and Brilliant or Photofractional Light. And then I've done some jawline filler. And here she is 4 years later. And so, again, you'd never see her at the mall and think she had anything done. She looks like herself. Is her nasolabial folds completely gone? No, but sometimes the evil of good is perfection. So, getting rid of every detail is sometimes the tell that someone's had something done. The goal is to just make her look like a more refreshed version of herself. And that's what we've accomplished. Okay, this beauty started with me in her 30s. And you'd look at her and you'd say she looks like she's 24, but she's actually 38. Here we did a little bit of Dysport again, upper lower face, Sculptra, Bellatero into her tear troughs. That's not something I do on everyone, but on her I did. Jawline filler, all therapy for her, just to keep the skin underneath her jaw tight. I did take 10, and then I put her on ExoMD because she has this underlying redness to her skin. Here she is 8 years later. So 8 years later, she kind of looks healthier than what she started. She doesn't have that redness anymore because of ExoMD. and she just looks more lifted. So doing these things over time, I mean, she doesn't look done. She just looks like herself, just like a more refreshed version. And then this beauty, she started with me in her 40s. Again, Sculptra, all therapy, neuromodulators, photofractional light. I did a take 10 on her. And let's take a look at her. And here she is 9 years later. So 9 years later, she doesn't look like she's aged. She looks a little prettier, and that's just about it. It's not like we're trying to radically make her different. So celebrating subtle, I think, is a great way to stay looking natural during the course of your aesthetic journey. It's the people that are trying to aim for a radical before and after with every single intervention that end up drifting along the way. I think the people that look the best are those that are consistent. Just like going to the gym, you get your six pack, you don't maintain it if you don't go back. You got to go back. It might be hard to get it initially. You've got to kind of front load and do a lot of work. But then once you've gotten there, just a little bit of maintenance every single week. And in the case of these procedures, every single 3 to 4 months with something small, I think is what breeds the best results. And so, with that, I thank you for your attention and I'll open it up to questions for those that may have them.
Amazing. Thank you so much, Dr. Fabi. It was so great to hear you talk through that and to look at all the before and after photos as you go. All right, guys. So as Dr. Fabi said, we are live and ready for questions. So we have the first one coming up, and everyone else, you're welcome to use the feature to pop in any questions you may have. This is a great opportunity. All right, here's a good one. Big topic. Thinking about using GLP-1. Any suggestions before your next talk in order to prepare?
Um, so right now we recently came up with the first international consensus guidelines on what to do if you're going to be starting GLPs. And I think that what I think there was like 9 of us globally that came together. Um, we believe that there might be an inhibition of stem cells that occur at the level of the skin that contribute to some of the rapid accelerated aging changes that I'll go more into detail and present some of the initial trial findings that we're doing in our office right now. But the consensus is doing lasers to begin with. The moment that you start the GLP, starting to do laser treatments is recommended. Just like if you start a GLP, probably seeing a nutritionist so that you can make sure that you have the right protein intake, or just like you start a GLP and you're going to see a personal trainer to make sure that you're doing the lifting so that you don't lose your lean body muscle mass. So there's all these things that one should be doing if they're going to start GLPs, and along that is taking care of your skin. So that's presently what the consensus recommendations are. After you've lost about 4 to 5 kilos, or roughly about 10 pounds, then that's generally where many of us started recommending biostimulators to stimulate some of those adipocyte-derived stem cells.
Amazing. All right. Well, that was a great tee up for her next webinar, which is going to be in March. All right. Here's a great one. Is there any risk of melting fat unintentionally with therapy?
With all therapy, there have been no studies to actually show that it melts fat. Outside of the United States, there are many copycat devices that have all therapy stickers on them, but they're actually HIFU. HIFU is very different. It's not microfocused. And so the beam of those waves are much bigger and deliver a lot. Fat gets destroyed as a function of time and temperature. So you need a certain amount of temperature, but you also need it to be exposed for a certain amount of time. That's the reason why the FDA most recently came out with guidelines around microneedling RF potentially melting fat. So it's actually the microneedling RF technologies that have a greater impact on the fat. Why? Because those needles go in, and there's so many of them, whether there are 49 of them or however many there are, and they're all in a very small compact area. So that amount of heat for that amount of time is enough for the fat to destroy. With all therapy, you don't the coagulation points are spaced out far enough. That's one. The delivery of each beam is less than like a microsecond, and the size of the beam is 200 microns. So the amount of the injury, the size of the injury, and the time that that injury is delivered is not enough to actually melt the fat. So we have not seen it with all therapy. But perhaps with a copycat that has a sign on it that says all therapy, perhaps.
Good insights. All right, here's a great question. When I watch the Take 10 presentation, it looks great, but then I see the Take 5 presentation and it also sounds great. How would you help me decide between the two?
I think it really comes down to your downtime that you have, down time and money, right? Like, because there's obviously a difference in both of those things depending on the procedure that you have. And honestly, what I tell my patients is that one doesn't negate the other. So it's not like you it's like you're putting money in your skin savings account. So if you're taking a take 10, it's a big contribution to your skin savings account. If you're taking a take 5, it's half the amount, into your skin savings account. I have many people that do the take 5 and then one day they do the take 10 because they have the downtime to be able to give me that. I find that the take 10 doesn't do as much for crepiness around the eyes or lines around the mouth. So if that's your issue, then perhaps consider more of a take 10.
That's really helpful. All right. Will IPL work for Asian skin? And if so, how many sessions to generally see results?
Well, not all Asian skin's the same, just like not all Hispanic skin's the same. I'm Hispanic, but many people would say that I'm very light for being Hispanic. So it depends on what kind of Asian skin you have. If you're a Fitzpatrick 5 from South Asia, perhaps IPL would not be the ideal treatment for you. So it depends on the degree of melanation that you have. So that's why being assessed to determine how much melanin you have, then we can be able to determine which laser is best for you. And that's why we have over 50 of them to be able to customize it to your skin type. Ooh, you're on mute, Risa.
My dog started barking.
Oh, it's okay. I
How
have my kid
often
in
is
the
it safe
background.
to have laser treatments, particularly when you get more than one laser per treatment?
Well, many studies do the laser treatments as early as every month. Um, Now the more pressing question is, do you really need a laser every month? I don't think you really need a laser every month. If the laser treatment's effective, I think that you can get away with doing one as soon as every 3 to 4 months, but your issue should probably be cleared enough that you don't have to do something then as frequently as every 3 to 4 months if the laser is properly being utilized.
Can sculpture make your face look more bloated and puffy?
Depends on the plane of injection. I haven't seen it in my patients because I'm very conscious about injecting along the bone. But it's like with anything, can it create a problem? Absolutely. All of the things that I talked about tonight, if done and used inappropriately, can absolutely create an unintended adverse event.
Absolutely. Um, what would you recommend for hollow cheeks due to weight loss?
Depends on the degree of weight loss. So back to the consensus recommendations that we put out that are globally based. If it was between 4 to 5 kilos, we recommended Sculptra. But after that, when somebody started losing about 20 pounds, you are going to probably need a combination of an HHL as well.
Got it. Okay, here's a great question I am personally interested in. What are some good treatments for under eye crepiness and wrinkles?
I think the under eye crepiness is best addressed with the Take 10. In my experience. There is no doubt. Now, neuromodulators like Botox can definitely help some of that skin and some of those lines to a degree. And so, making sure that you go to someone that can treat immediately underneath that lid margin, that will absolutely help. But if you can only put so much in, and then you're going to potentially need, the laser. And then sometimes it is caused by a little bit of volume loss along the cheek. And so putting a little bit of sculpture along the volume of the cheek, I just recently published, did help with that skin tightening in between the lid of the cheek and the skin, the lid cheek junction. So putting a little bit of sculpture there can help stimulate some collagen and thicken up the skin.
Got it. And I guess a follow-up question to that is, do you offer under eye fat transfers or how would you treat under eye hollowness?
Depends on the reason why. Because as we get older, we lose the fat behind the eyeball itself. And so if the eye is sunken back, no amount of fat transfer in front of the eye is going to address the issue. So I think it's important to be, again, assessed. I think that some of the reasons why people are looking at natural these days is because people are leading with a treatment instead of leading with a diagnosis. So this is ultimately the practice of medicine, right? You have to have a diagnosis before you go do a treatment. But if you go do treatments on people and there's been no assessment or diagnosis, then people have a bunch of adverse events like looking peculiar and weird. And it's because they led with treatment. So we have to understand why. So is it because the eyeball is sinking back? There are certain oculoplastics that do fat transfer behind the globe. I want to say my colleague, Dr. Julie Woodward at Duke, does this. So you can definitely see her. But that would be something that would be of consideration. Some people put an HA gel behind the eye. Jocelyn Cohen out of Chile does this. So many people do different things. So you have to have an assessment. If the fat is actually within, too much fat was taken after a bleph over the lower lid, or you have an A-frame deformity, there a fat transfer might be appropriate.
Got it. Is there any contraindication to getting therapy after fillers? And how long after fillers can I do therapy?
There's no contraindication because the beautiful thing about all therapy is that you can visualize your filler. And so if you can see the filler, then you don't fire over the filler. Most filler isn't placed in the plane that we do all therapy. We do fillers deeply. You would never want to actually put the filler where all therapy fires because all therapy targets SMAS. So that's not where you want your filler placed at all. And so you want your filler placed generally along the deep fat or along the bone so that it doesn't move or migrate. Therefore, all therapy is well above that, and you should never actually come close to it with all therapy. But just the safety mechanism in it is that you have the tool to visualize. We generally wait about 2 weeks, and that's what the consensus recommendations that we came out with in 2014 state, which is waiting 2 weeks after filler if you want to do all therapy.
Got it. Um, is it usually not recommended to use fillers to treat jowls on rounder faces or heavier jawlines?
It depends because you may have a weak chin that's contributing to the appearance of the jowl. And so the lack of projection of the chin is what makes the jowls look worse. I actually showed a photo of that with one of my patients. And so in building her chin, her jowls minimized. So it depends again why one has the issue. So an assessment would help with that.
Got it. Definitely a theme here. All right. Are any thoughts between therapy and thermage? It's a tough question.
Yes, L-therapy penetrates deeper than thermage. And it also allows us to visualize where thermage does not allow us to visualize. So I'm in the camp of being able to visualize what I'm treating because in a study that we actually did in the practice, we found that 55% of the time your SMAS is actually more superficial than you think. So you'd never know that if you didn't have ultrasound to be able to guide you in your treatment. So because of that, I'm able to personalize the treatment. And so that's why I prefer actually all therapy to soft wave or thermage.
That's really helpful. And just so you guys know, in our practice, we love therapy too much. We actually have two therapy devices. And just in case, we also have thermage and soft wave. So we really do offer the entire gamut. So that was just really Dr. Fabi's true personal
Yeah, I
scientific
just had my
opinion.
all therapy done, a week ago. So if it melted fat, I would probably have no fat because I've had it done every year for the last 14 years. So it definitely doesn't melt fat. I still have a very full face, and it's still my treatment of choice when it comes to repositioning tissue.
What would be your recommended age to start therapy?
I personally started it when I was 31. I think it depends on the anatomy, again, assessment. That's my theme because I think it informs what the plan should be, and then therefore you're doing something that's indicated for the individual so that they don't look weird from the procedure that you're trying to do. So in a fuller face, in a heavier lower face, Generally, Hispanics, Asians, that's why this all therapy is the number one procedure out of Korea, because it generally, those patients have a heavier lower face. And so people start in their 30s in that age group because you don't want to put a bunch of filler to lift the tissue of the lower face. So it just really depends on what the anatomic issue is.
All right, guys, we have like one more minute. Let's squeeze in a few more with Dr. Fabi. So, if you've had soft wave before, how long do you need to wait before you could try all therapy? And how often do you recommend to repeat all therapy?
Again, all therapy penetrates at a completely different level than soft wave. Soft wave only penetrates 1.5 millimeters. So you can do all therapy whenever you want. If you did a soft wave with the intent of lifting, then perhaps give it a fair shot, of 3 months before you do all therapy so that you can see what the soft wave did for you.
Okay. And I guess maybe the last money question here is, do any of these treatments you've been talking about impact if you want to get a facelift down the line?
There's a great, again, consensus recommendation because I like science to inform me, created by a group of facial plastic surgeons, Mike Nyack being one of them, who's a very famous plastic surgeon in the United States. And they essentially said generally waiting you can do these interventions up to 6 months before your facelift. And so that's based on facial plastic recommendations.
Got it. So someone that comes with you, all these before and afters that are getting consecutive treatments over long periods of time with you, if in another 20 years they think they need a facelift, they will be able to.
Yeah, actually did a retrospective review of my own patients that have undergone facelifts, and we found that of the 20 that have undergone facelifts, they actually were coming back to see me in as early as 6 months for their neuromodulator, 1 year for their filler, a year and a half for their Sculptra, and 2 years for their all therapy. So that should just guide everyone to kind of recognize that facelifts do not stop you from needing all of those things all over again. But I recommend facelift when you've reached a point that something's driving you mad and I can't fix it. And if it's driving you mad, I want you to be happy and I want you to be able to fix it. So if it can fix it, fine. But you shouldn't be doing it because you think it's going to stop you from needing things in the future, because that's not what we've seen.
Okay. All right. I think there's so many good questions here, but I think we need to call it, guys, and let Dr. Fabi get on with her evening. She had a busy day seeing patients already, and her little one is probably waiting.
Yeah.
So, thank you, Dr. Fabi, so much for your time. For everyone that joined, I really appreciate you spending your time with us. And you guys had some really great questions tonight. I learned a lot myself, so I appreciate it. And ultimately, if you would like to schedule a consultation with Dr. Fabi, it would be great if you could call our office first thing in the morning, or you can send us a contact form, and I will pop that link in the chat right now. And make sure to tell Dr. Fabi when you come in that you saw this webinar so she knows, and she knows you've had this basic education. And again, feel free to share this with any friends or family because it's rare to get such a true, authentic, feedback on the big picture of where we're going with facial aging. And it's really great to hear it from Dr. Fabi. Yes, you will get a replay link. We will be sending it out this weekend. If you need it sooner, just email us and we can send it over sooner.
And
So
then, Risa, how would they get the 10% off if they're interested in XO? They have to call the office for that,
yes, so
right?
please call the office. You can purchase it on the phone, over the phone with us or over email, and we can ship it to you. Or you're welcome to come in if you want to feel it, taste, try it, not taste, because and see the beautiful bottles. Or you could even schedule a consultation with Dr. Fabi to discuss because there's a few different products in the XO MD line, and if you want her guidance, you could schedule with her. But we also have great retail specialists that are available all the time that we're open in the waiting room with all of our skincare that can help guide you as well. So we
Thank
have everyone's name that was here. We will save a list, and all of you are eligible for the 10% off. And we will be going through to pick a winner at random, and we will notify them personally first and make sure they're okay. And then we will share it on social media.
All right, guys. Well, thank you very much for your attention tonight.
Yes,
I
thank
hope
you
to see
so
you
much.
all back. I believe it's Tuesday, March 17th,
I was just
same
about to
time,
say,
and I'll be talking about the impact GLP-1s have on accelerated facial aging. Thank you so much for
yes.
your
So
attention, you
save the
guys.
date, everyone. All right, good night.
Bye.
Bye.